America has been hit by the coronavirus, and in particular, the music industry has been hit. I'm Scoot. I'm upstairs in a room at the historic Napoleon House restaurant in the historic French Quarter of New Orleans. And I'm sitting with some people who are going to have a roundtable discussion with us about coronavirus, and in particular, how it has affected the music industry. Roland Guerin is with us. He's got a new album out titled Grassroots. Here's that. Dexter Allen is a singer-songwriter from Mississippi. Dexter Allen live from Ground Zero Blues Club. See, I get to keep all these, you know. I score all this. And Lily Lewis is a label manager for Louisiana Red Hot Records, and they just won the Offbeat Label of the Year. And Lily's album is Lily Lewis Project, We Belong. Also, first up, I want to introduce Dr. MarkAlain Dery. Dr. Allen has an interesting background. He's a bass player, musician, and you're an infectious disease doctor.
Yes.
So talk to us, and as each of you talk, we're going to make this very relaxed, but just, you know, kind of grab the mic and pull it towards you. I am a germaphobe, so
am I.
I've been concerned about germs for a long time. I can't say that coronavirus has changed my life very much, but what is it that you would like people to know, facts versus fiction when it comes to coronavirus?
Sure. So the three recommendations that I've been telling people regularly is hand washing, hand washing, hand washing. That is single-handedly the most important thing. I keep these with me everywhere I go now more than ever. So this is a hand sanitizer, right? And if you're going to be using a hand sanitizer, you want to make sure that it has 60 to 90% alcohol. If you're going to be hand washing with soap and water, you want to at least do it for 20 seconds. So pick 20 seconds of your favorite song, right? Wash your hands that way, soap and water.
And so do we do it 20 seconds because, like, after 10 seconds, some of the germs are hanging on to dear life?
So 20% or 20 seconds, somebody I'm sure did a study somewhere that showed, you know, that probably got rid of 99% of the germs on the hand.
Since this is your job, and you're also a musician, how surprised are you that this has so quickly affected the music industry?
It was predictable. It was absolutely predictable. I mean, as somebody who's studied infectious diseases literally my whole life and has been a physician for the past 20 years, specializing in infectious diseases, this is how epidemics affect society. So this was something that was easily predictable, especially when studying previous epidemics that are very well documented. When you look at the last big one that happened, I mean, you know, in 1918, influenza virus decimated the globe. I mean, upwards to 100 million people. So you expect that things like this would happen, especially when you're looking at folks, you know, quite like yourselves that work in the entertainment or the service industry, where folks are, you know, quarantine is going to be the rule of the day coming up here very soon. In China, they quarantined 100 million people. It's 10% of the population. In Italy, they quarantined 16 million people, which is the entire population of Italy. And in doing so, they had networks in which food and delivery and this sort of stuff. In Italy, they've suspended mortgage payments to help relieve the pain of quarantine. Unfortunately, here, this country is just not built on a system like that. Between a very patchwork healthcare system and a social system that's constantly being rated budgetary-wise, it's just going to be difficult. And those that are most at risk, besides the service industry folks and my esteemed colleagues here, you know, the three populations that I'm also very concerned about are those that are in the carceral system that are literally locked together. We're going to see significant problems there. In nursing homes, we're seeing problems in Seattle. And then lastly, in overnight homeless shelters. So I'm afraid that this is going to shift people who are already maybe somewhat housing insecure, possibly into some homelessness. So I have a feeling that the days ahead of us, unless we act appropriately, could potentially be problematic.
How uncomfortable would you be walking down a crowded Bourbon Street tonight?
I would not do that.
Really?
Yeah. I would not do that. I think at this point it's wise to avoid crowds. And I've been advising. I have a large HIV conference this weekend that had been planned. We've been planning it for 6 months. I just canceled it. I'm a host of a radio program myself. We were going to do a live broadcast on Monday night at the Ace Hotel. Canceled that as well. So I'm suggesting, I think that what the mayor did this weekend, I think was completely appropriate.
So compared to the more common strains of the flu, tell us the big difference with coronavirus. In addition to the lethal rate, we know that, but in terms of communicability, if that's the right word to say.
I know exactly what you're asking.
Okay.
So coronavirus essentially circulates already amongst the human population as a common cold, and it accounts for 10% of the colds that we get. So as somebody who's 51, if I get a common cold every year, it stands to reason that over 5 decades I've gotten a coronavirus at least 5 times, right? But that virus that circulates is acclimated to human beings. It originated from an animal source, but it has since acclimated to the human immune system. The same thing with the influenza. When an influenza jumps directly from an avian or from a swine into the human population, it's particularly lethal. But now the flu has acclimated to the human population and circulates. So this particular coronavirus, the reason why it's called a novel coronavirus is that it's new. And what's new about it is that there is an animal host that's likely a mammal host, which was a bat, that went to a secondary host that we don't know what that secondary host is, and then from there it jumped into the human population in something that's called zoonosis. And because it's now jumped in the human population, that virus is very new to the human immune system, and that's why this is particularly lethal. It's more infectious than the influenza, and it's also has a higher mortality rate. Now, from a virus's perspective, it doesn't want to kill its host, right? That's not to the evolutionary advantage for a virus to kill its host. So eventually, it's going to chill out. As it starts to circulate through humans, it's going to lose that edge in which evolutionary pressure is going to force it to become less lethal and less infectious. But that's just going to be over a course of time. And unfortunately, there's going to be people who are going to be infected, and there's going to be some issues.
When you talk about hosts, I mean, this is just taking me right back to the movie Outbreak, which freaked me out.
Sure.
How similar is this to what we saw in Outbreak?
Well, the movie Outbreak was focusing on Ebola, particularly, which is a virus that's communicated through touch. And so or at least I don't remember the movie, at least the book was about Ebola. This is a little bit more random than touch. So during the Ebola outbreak, I went down to Sierra Leone and did 4 months with the World Health Organization as a clinical epidemiologist. So I was on the front lines looking for cases of Ebola, active cases. And I was very secure because I just never touched anything, because I'm very, like yourself, I'm a germaphobe. I'm very obsessed where my hands are. This virus is a little different because there's the randomness plays a role here in the form that it is transmitted through droplets. So you could just be standing around, somebody could be coughing 5 feet from you, and that cough or that sneeze may have found their way inside to your lungs. And so 80% of people who experience this that are going to have kind of a common cold-like, symptoms, and it's those that are a little bit more advanced in age and then have other chronic health problems that are going to be more at risk for some more severe expression of the illness.
I find it fascinating that you would go to the front line where these people are all infected, but you don't want to walk down Bourbon Street.
Yeah, I mean, I was evaluating patients today, but I when I evaluate patients, I'm wearing masks and gowns and that sort of stuff when I'm walking down Bourbon Street.
The cloth mask. I mean, is it people wearing it even though we're told by many experts that it doesn't work?
Sure. So let's do the mask. So the size of the virus is 0.1 micron. So let me give you context to that. So the width of a human hair is 75 microns. So this is a very small organism. So when you look at the stitching of a mask, right, compared to what it's trying to hold back, it's like using a chain link fence to hold back flooding waters. It's just not going to work. So that's for a surgical mask, right? So the surgical mask was invented so that the surgeon, she did not spit or cough or sneeze into her open surgical field, right? But the surgical mask may be helpful in preventing you from touching your face inadvertently. So that may be a place. Remember, the mask started with the SARS virus in 2003, and that really came from the fact that the Asian people who started wearing masks are so considerate that in their culture, it was considered, you're considered rude if you're coughing, sneezing, or have a runny nose, and you're not wearing a mask to protect others. And that's where that came from.
That was one of the things to this day that stands out in my mind about going to Japan, is that the Asian culture is so considerate that if they're sick, they don't want you to get sick, so they're prone to wear masks. And for example, in Tokyo, look how close everybody is. There's no social distancing there.
Absolutely. I do have 3 recommendations. 1, hand washing, hand sanitizer, soap and water, 20 seconds. The second thing is, please, 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 anybody who's listening to me, please go to the pharmacy and buy an oral thermometer. Okay, or if you have a thermometer at home, please make sure it works. Because if you call the doctor and if you develop a fever, the first thing we're going to ask is, what's your temperature? Now here's the funny thing about the human body. You may feel like you're burning hot, and oh my God, I've got a fever, and everybody says that they have a fever. We put a thermometer in them, they're 98.5. So your perception of a fever does not match a real fever. So we're calling anything above 100.4 Fahrenheit or anything above 38 degrees Celsius a fever. So please go get a oral thermometer so that if you do get sick, you can talk smartly, or you can talk accurately, objectively with a healthcare professional. And then the last thing is go get your prescriptions, go get them early, and then get cough medicine, over-the-counter cough medicine, ibuprofen. Just stock up on flu and cold medicines in the event that you do get the virus.
How bad could this get?
I mean, I wouldn't be surprised if we see a lot of people develop the coronavirus. Again, the majority of people are going to it's just going to be like a flu and cold season. It's just that, you know, I have a feeling that life is going to be disrupted. So life as we know it is going to be disrupted.
When will the main threat start to ease?
It's hard to say. I would say that if I were to take a guess, I would say that we're going to probably be living disrupted lives for probably a couple weeks, maybe a little bit more than a couple weeks. I wouldn't be surprised if some of our bigger festivals coming down the line are canceled or rescheduled. Musicians may get sick wherever they are and they can't make it over. Airlines may not be flying. I mean, there's a lot of factors. So I have a feeling that life as we know, especially and I say this again to my esteemed colleagues here, that life as we know it is likely going to change. And I'm just trying to get people ready for that.
Well, Dr. MarkAlain Dery, thank you for the very important information.